In our last video, we discussed encounter anxiety, which is a form of anxiety that's associated with being unsure about how to navigate an encounter with a person with a disability, abbreviated PWD. And this is often due to a lack of experience with PWDs, and it can lead to poor communication with PWDs. For example, research shows that people often infantilize PWDs. In one study, for example, college students used more words and a higher voice pitch when giving directions to a person in a wheelchair compared to a person not in a wheelchair. Patronizing PWDs is a form of ableism, which we've already discussed, and this should be avoided. In this video, then, we'll briefly discuss a set of suggestions for how to navigate an encounter with a PWD. Here's a list of strategies that you can use in your interactions with people with disabilities, or PWDs. And this is taken from Wilkin and Ward in 2007, and I'll simply read through each in turn. First of all, speak directly rather than through a companion or a sign language interpreter who may be present. Second, offer to shake hands when introduced. People with limited hand use or an artificial limb can usually shake hands, and offering the left hand is also an acceptable greeting. There's nothing wrong with that. Third, always identify yourself and others who may be with you when meeting someone with a visual disability. When conversing in a group, remember to identify the person to whom you are speaking. And when dining with a friend who has a visual disability, you can ask if you can describe what's on his or her plate. Fourth, if you offer assistance, wait until the offer is accepted. Then listen or ask for instructions. It's always perfectly fine to offer help. Don't just assume they're going to need it or want it, though. 5, treat adults as adults. Don't infantilize them, right, as we've already referred to. Address people with disabilities by their first names only when extending that same familiarity to others. Never patronize people in wheelchairs by patting them on the head or shoulder, for example, and you can imagine all sorts of other behaviors that would fit into this general advice of treating adults like adults, both in how you behave and what you say and so on. Sixth, do not lean against or hang on someone's wheelchair. Bear in mind that people with disabilities treat their chairs as extensions of their bodies, and so do people with guide dogs and help dogs. Never distract a work animal from its job without the owner's permission. 7, listen attentively when talking with people who have difficulty speaking and wait for them to finish. If necessary, ask short questions that require short answers or give a nod of the head. Never pretend to understand. Instead, repeat what you have understood and allow the person to respond. 8, place yourself at eye level when speaking with someone in a wheelchair or on crutches. 9, tap a person who has a hearing disability on the shoulder or wave your hand to get his or her attention. Look directly at that person and speak clearly, slowly, and expressively to establish if the person can read your lips. If so, try to face the light source and keep hands, cigarettes, food, whatever, away from your mouth when speaking. If a person is wearing a hearing aid, don't assume that he or she has the ability to discriminate your speaking voice. Never shout to a person, just speak in a normal tone of voice. And finally, relax. Don't be embarrassed if you happen to use common expressions such as "see you later" or "did you hear about this" that seem to relate to a person's disability. And hopefully you can see from all of this, the main theme here is to treat people with disabilities like anyone else. You can offer help when it's appropriate. You can offer assistance. Just be respectful, talk normally, treat them normally, just like anybody else. So I don't think this is all encompassing. I think these are just some suggestions to get you thinking along the right track.